So we're gonna go over lengthening with the pelvic floor and talk about positioning. So I have a wedge here. So this is a wedge that I got off the internet, and I like to prop it up behind you. You can also add a couple pillows, so I'm just gonna put more pillows just to prop me up. And then I wanna have some pillows underneath my legs as well. So I'm gonna move you over here, and just so you can kind of see what I'm doing here. Okay, so now I'm leaning back against this wedge with pillows. I'm gonna put a pillow underneath my legs so you can kind of see that, and then I would have one under my other leg as well. But I'm gonna keep this open just so you can kind of see what I'm doing. And then, so we're here, so preferably I like to make sure that you start with the tissue warm. So that's after you've started, like you had a bath or a warm shower. So that way the tissue will have more of a flexibility with stretching. So you'll lean back, have both your legs out in butterfly position underneath a pillow, and you're gonna start with the first part of the pelvic floor wand. So I like to start on this side, so that's gonna be 3 o'clock. So if we're thinking here, so this is 12, this is 6, I'm coming in right here towards the side, and you're thinking of lengthening the inside of like a bagel, and the pressure should be light. So it's the pressure you'd be pushing on, think of a ripe tomato. So if I'm pushing on a ripe tomato, I'm not gonna push super hard because that's gonna break the skin of the tomato. Same thing with pelvic floor. It's all very light. So you'll come here, do some deep breathing. Inhale, belly out, exhale, belly in, upper body's relaxed, and just start to go around. So try to hold each position 10 to 20 seconds, do some deep breathing, go around the clock, and then you'll go to the other side. So I'm gonna switch hands to get to the other side. And again, we're thinking up at 11 o'clock, coming all the way to the side. So you go through each 11 o'clock, 10 o'clock, 9 o'clock, so slowly start going all the way around. After you've done both sides, then you're gonna go to second layer. So that's about that side, or like that much. And then same thing, you'll start on the side that you first started with and gently go in, do some deep breathing. You can use a mirror right in front of you so you can kind of see what you're doing. I always recommend, like, try to, as you go in, try to angle about like midway, but towards, you know, the bottom. You don't want to angle up at 12 o'clock because that's where your urethra is, and that's not going to be comfortable, but you can go all the way around from 1 to 6 and then 6 to 11. And again, if you're comfortable, then you can go to third layer. So that's about that much, or like that much of your finger. And again, you would start on one side, go all the way to the other. If there's a area that feels a little bit tender, stingy, burny, so that's basically the muscles getting stretched. Take some deep breathing, see if that gets a little bit better, and then you'll move on. But I usually say try a few minutes on each side, so that's between like 5 to 10 minutes total, and then you're done. So the recommendation is every other day, so 2 to 3 times a week. At first you can just start with once, and then as you get more comfortable, you can progress to 2 to 3 times a week. So give that a try. Remember, the pressure's light. You're basically just trying to lengthen some of these pelvic floor tissues inside, and it takes a little bit of time, and you can expect to have a little bit of tenderness, but nothing more than a 3 out of 10. Usually it kind of just feels like the area got stretched, so give that a try.